Administering medication through subcutaneous injection, first you need to gather the equipment, check the medication order against the original physician's order according to agency policy, clarify any inconsistencies, and check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, and purpose of administration and adverse effect of the medication to be administered. Consider the appropriateness of the medication to this patient and perform hand hygiene.
Move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Prepare medications for one patient at a time. Read the medication administration record and select the proper medication from the patient's medication drawer or unity stock. The label with the medication administration record and check the expiration date and perform calculations if necessary. If necessary, withdraw the medication from an ampule or vial as prescribed in the previous skills. When all medications for one patient have been prepared, recheck the label with the medication administration record before taking them to the patient.
Withdraw the medication from ampule or vial.
Transport the medications to the patient's bedside carefully and always keep the medications in sight. Ensure that the patient receives the medication at the correct time.
Identify the patient. Usually the patient should be identified through checking the name and identification number on the patient's identification band. Ask the patient to state his or her name, and if the patient cannot identify him or herself, verify the patient's identification with a staff member who knows the patient for the second source.
To the room or pull the bedside curtain. Complete necessary assessments before administering medications. Check allergy, bracelet, or ask the patient about allergies. Explain the purpose of the medication to the patient.
Clean the site with an antimicrobial swab while wiping with a firm circular motion and moving outward from the injection site. And allow the skin to dry. Remove the needle cap with the non-dominant hand by pulling it straight off. Grass and batch the area surrounding the injection site or spread the skin taut at the site. Hold the syringe in the dominant hand between the thumb and forefinger and inject the needle quickly at a 45 to 90 degree angle. After the needle is in place, release the tissue, and if you have large skin fold, pinch up, ensure that the needle stays in the place as the skin release. Immediately move your dominant hand to steady the lower end of the plunger and avoid moving the syringe. Inject the medication slowly. And withdraw the needle quickly, and using a gauze square apply the gentle pressure to the site. After the needle is withdrawn, do not massage the site. Do not recap the used needle. Engage the safety shield or needle guard if present. And discard the needle and syringe in the appropriate receptacle. Assist the patient to a position of comfort and remove the gloves and dispose them properly and perform hand hygiene.